Good afternoon, everyone, and welcome to the Nurse's Corner with your nurse, TANEISHA. Today we are going to be discussing the topic gastroesophageal reflux disease, otherwise called GERD or even acid reflux. In gastroesophageal reflux disease, stomach enzyme and acid flow backward from the stomach into the esophagus, causing inflammation and pain in the esophagus. The stomach lining protects the stomach from the effects of its own acid. Because the esophagus lacks a similar protective lining, stomach acid and enzymes that flow backward into the esophagus routinely cause symptoms and, in some cases, damage. Acid and enzymes flow backwards when the lower esophageal sphincter is not functioning properly. When a person is standing or sitting, gravity helps to prevent the reflux of stomach contents into the esophagus. This explains why reflux can worsen when a person is lying down. Smoking and certain foods, such as chocolate, interfere with the sphincter muscle, making reflux more likely. Reflux is also more likely to occur soon after meals when the volume and acidity of contents in the stomach are higher. Alcohol and coffee also stimulate acid production. Symptoms and complications. Heartburn is the most obvious symptom of GERD. Heartburn is a burning pain behind the breastbone. Sometimes the pain even extends to the neck, throat, and face, that is in severe cases. Heartburn may be accompanied by regurgitation, in which the stomach contents reach the mouth. Inflammation of the esophagus may cause bleeding, and that is usually slight, but it can be massive at times. The blood may be vomited up or it may pass through the digestive tract, and this will result in the passage of dark, tarry stool or even bright red blood. That is if the bleeding is brisk enough. Esophageal ulcers, which are open sores in the lining of the esophagus, can result from repeated reflux. They can cause terrible pain that is usually located behind the breastbone or just below the breastbone, and that is similar to the location of heartburn. Narrowing of the esophagus from reflux makes swallowing solid foods increasingly more difficult. Narrowing of the airways can cause shortness of breath and wheezing. Other symptoms of gastroesophageal reflux include chest pain, sore throat, hoarseness, excessive salivation, a sensation that there's a lump in the throat, and even inflammation of the sinuses. Diagnosis. The symptoms of GERD point to the diagnosis. Treatment can be started without detailed diagnostic testing. So a doctor can diagnose gastroesophageal reflux disease based on the symptoms that you are having. Specific testing is usually reserved for situations in which the diagnosis is not clear or treatment has failed to control the symptoms. Prevention and treatment, because GERD, it can be prevented and it can also be treated. Several measures may be taken to relieve gastroesophageal reflux. Raising the head of the bed about 6 inches can prevent acid from flowing into the esophagus as a person sleeps. Specific foods should be avoided, and these include fat and chocolate. Smoking and certain drugs should also be avoided because these increase acid production in the stomach. Coffee, alcohol, and other substances that strongly stimulate the stomach to produce acid or that delay stomach emptying should strongly be avoided as well. Antacids taken at bedtime, for example, are often helpful. Antacids can usually relieve the pain of esophageal ulcers by reducing the amount of acid that reaches the esophagus. You also have other treatment methods such as proton pump inhibitors, where you get your Zantac and other medications. Surgery is an option for people whose symptoms are unresponsive to drug therapy, or for people with esophagitis that persists even after symptoms are relieved. In addition, surgery may be the preferred treatment for people who do not like the prospect of having to take drugs for many years. A minimally invasive procedure performed through a laparoscope is available. However, 20 to 30% of people who undergo this procedure experience some sort of side effects, most commonly difficulty in swallowing and even a sensation of bloating or abdominal discomfort after eating. But again, surgery is the last option. That is it today for gastroesophageal reflux disease. Before I go, I would like to leave with you the health tip for the day. The health tip for the day is, it is health that is real wealth and not pieces of gold and silver. Again, it is health that is real wealth and not pieces of gold and silver. Again, I'm TANEISHA COLQUHOUN, and thank you for tuning in to the Nurses Corner. I will see you at another time, same place, right here on Tops Radio, where we will have another health topic for you. Have a wonderful afternoon, and remember, healthy living is not a goal, it is simply a way of life.
Tops Radio and Associates take no responsibility for the opinions or statements made by the host or their guest. Statements or show topics are not necessarily the beliefs of this site or this radio station. It's not our intention to libel, discriminate, make hate, or annoy anyone. This site or radio station takes no responsibility for the opinions of others in the postings of comments in chat rooms or forum posts.
The pain is getting worse.
Ladies and gentlemen,
the number one station. The number one station.
it's always hot.
Tops Radio.